you are welcome to Health Monitor, committed to tutorial well-being. And in this video, I would like to talk about peptic ulcer disease. What is peptic ulcer disease? What are the causes of peptic ulcer disease? Risk factors to peptic ulcer disease, clinical features, and of course, management of peptic ulcer disease. That is how we can manage peptic ulcer disease at home and how we can manage it in the hospital. So having said that, now PUD, peptic ulcer disease, is an excavation that is formed in the mucosal wall of stomach and duodenum caused by erosion of mucous membrane. PUD is manifested by two types of peptic ulcer, namely gastric and duodenal. That is, we have two types of peptic ulcer disease, which are gastric ulcer and duodenal ulcer. So moving away from that now, let's now quickly look into causes of PUD. Causes of PUD. Well, to be candid, the cause of PUD is idiopathic, that is unknown. However, research has documented that PUD result from infection with gram-negative bacteria called Helicobacter Pylori, which may be acquired through ingestion of food and water. Having said that, risk factors of PUD may include hereditary, stress and anxiety, excessive smoking and alcohol intake, excessive ingestion of caffeinated food and beverages, chronic use of non-steroidal anti-inflammatory drugs called NSAIDs, chronic renal pulmonary disease, and of course in people with blood group O positive. So moving away from that now, let's now quickly look into clinical features of peptic ulcer disease. Clinical features of peptic ulcer disease include epigastric pain that begins either immediately after eating, as seen in gastric acid, or between 1 to 3 hours after eating, as seen in the duodenal ulcer, bloating, nausea, vomiting, abdominal distension, diffuse abdominal tenderness, absence of bowel sound as found in the perforated duodenal ulcer, dark bloody stool is also found in the perforated duodenal ulcer. So moving away from that now, let's now quickly look into management of PUD, management of peptic ulcer disease, pre-hospital management and hospital management. How we can manage it at home and how we can manage it in the hospital. So pre-hospital management now. Of course, the first thing that should be on our mind is place your patient in a comfortable position, suitable for that patient. Reassure patient and his or her relative, to relieve further anxiety. Reassess airway, breathing, circulation, and intervene when necessary. And restrict intake of milk for patients with gastric ulcer because it increases gastric acid. Encourage patients to take pap, honey, and blended food that are tolerated, and avoid those that produce pain. And encourage patients to take prescribed medications such as cimetidine, omeprazole, Gelisid, Gestid, and so on, like that. Encourage bed rest to avoid stress and fatigue, and transport immediately to the hospital if pain persists and if patient is vomiting. So having said that, now let's now quickly look into hospital-based management of PUD. Hospital-based management of PUD. Of course, the first thing in the hospital, reception and admission of patient, place patient in a comfortable position suitable for that patient, reassure patient and his or her relative, reassess airway brain circulation and intervene when necessary, connect patient to cardiac monitor if available, and then you assist doctor to secure IV access and to obtain blood sample for PCV, electrolytes and so on and so on like that. Administer prescribed IV fluid and medication, monitor fluid intake and output. Then the patient's relative should also be encouraged to participate in care and provide emotional support to patient, assist patient to identify situations that are stressful and exhausting, and explain coping techniques and relaxation method. And you also encourage patient to eat at regular interval, to eat at regular paced interval and in a relaxed setting. Encourage patient to avoid smoking and reduce alcohol intake, and we also encourage patient to avoid non-steroidal anti-inflammatory drugs, food and beverages that contain caffeine. And if patient is discharged, you stress the importance of complying with medication regimen and dietary restriction. I hope with this we will be able to know what peptic ulcer is. Peptic ulcer is an excavation that is formed in the mucosal wall of the stomach and duodenum, caused by erosion of the mucous membrane, and the main cause is due to gram-negative bacteria called Helicobacter Pylori. So on this note, I would like to say thank you for watching, and please subscribe to my YouTube channel Packaging 1-4. So till I come your way next, always remember health is wealth. I'm Emma Olatunji, and I say stay safe, stay healthy. Bye for this moment.